Gone to Vaikuntan from Malaysia. Now he's presently in Singapore. Vaikuntan Rajaratnam speaks Tamil, but he has been in many continents and many places. Right now, he's in Singapore. Vaikuntan, let's hear what you don't do.
Thank you. Good afternoon. It's first trip to Mumbai. Did bring my boat along. They said it was going to be floods, but anyway, arrived safely. Operations I no longer do. Surgery for tennis elbow. Just to show you where I am from, Singapore is a very big country, as most of you know. So my hospital is based in the northern part of Singapore. I assume this is the pointer. Yeah. Okay. So this is northern part. This is where I come from. The Center of Excellence in Hand Surgeries are all here in the southern part, NUS, then we have SGH and Tan Tock Seng. So we are not the recognized hand unit, but I work in the orthopedic department. Now this is a more important slide. It's a close-up of where I work. So that is the hospital. That's where I stay. And that is where the President of Singapore stays. And India must be proud. Her father is Indian. Okay, so that's the most important thing to remember. See, the operative technique for tennis elbow surgery is well documented. And I remember once Jesse Jupiter said, "What do you do for tennis elbow?" He told a story of somebody playing golf, and the wife called up and said, "My mother has passed away. The mother-in-law died. Do I bury her or do I cremate her?" And his answer was, "Do both, to make sure she doesn't come back." So when you do tennis elbow surgery, what I used to do was I did a release of the extensor tendon, the common extensors. I would do annulotomy. I would explore the PIN nerve and do a synovectomy if I find a synovial proliferation in the joint. And there you can see the plica there, which produces some click. And one of my boys, this was in Birmingham, decided to do an audit. It's a requirement for all registrars to do audit. And he found that there was a significant amount of problems that we had. I don't believe in evidence-based medicine, those who know me, because of two important phenomena which I asked you to go and look up, the Hawthorne effect and the Dr. Fox effect. You Google it and you read it. So we looked at our results over a one-year period. We did a fair amount. We did a postal questionnaire. And this was a specific questionnaire for tennis elbow developed by Dr. Paul Pinson, who was a research scientist who's got expertise in patient-reported outcome measures. And we had 39 cases that we had done, quite a significant number. And the results, this was the questionnaire, the instrument that we used to evaluate them. So I'm giving you my evidence base for why I don't do this operation. And that was the kind of results that we got. This is the so-called, they got better after operation, same and worse. But if you put the two together, they don't look very good. So 25% did not return to work after the operation. But this is British population, they got other problems with them. And this was what 70% returned to increased work. This was the staggering thing that is very important I want you to remember today. Now, only 50% of the patient got better. In any operation, when only 50% got better, you better not do it anymore, all right? So 39% had recurrence, another big problem. So we sent this for publication, and till today it's not been published. It was rejected because it had negative results. That is the fraud of medical publication. And this has been brought up recently at a very high level in the WHO. So failed publication due to negative results, and this is a quote from Karl Popper, "Every refutation should be regarded as a great success." So failure is a great success. So I went to look at the Cochrane database, and it's as everything in Cochrane database, 90% of the operations I do got no evidence, but we just do it anyway. There was insufficient evidence to say whether it's good or bad. Now look at it. They only had 191 participants from which to make that decision. And this database, Cochrane results, was obtained in 2011. Right? It's there. Now, if my paper was accepted, it would have added 20% to the database. And I'm not sure whether that would have altered that results. So that is an important thing to remember. The rest of it shows that actually there's nothing that works. Then I got bilateral tennis elbow. I had one injected, the other one I didn't. It all got better in the end after 18 months. So it's a rate limiting condition and it gets better. Thank you.
Thank you, Vaidyan. I think for in this condition, assume so everybody will have their own opinion. Because we are may I invite Professor Gilberman to say where does the evidence lie and what does he do and what he would do.
So I agree that this condition is largely treated non-operatively, and the natural history supports your observation that at 18 months, the great majority are better. Nevertheless, we have the occasional case of a patient, like my secretary, who persists with tennis elbow symptoms for many, many months beyond that and requires some type of treatment. And we found that, that on occasion in the right patient, operative treatment is warranted and is beneficial, but it's very select, and I would say probably greater than 95%, maybe 99% treated non-operatively. I agree with your findings. So.
Is there any way to find out who will get better? And if you find you, as in carpal tunnel, you told no night pain.
Right.
Similarly, you have anything?
I assume everyone's going to get better. And of course, we in the U.S., we don't do injections very much anymore, so we bypass the injections. Injections don't interrupt the natural history of tennis elbow. So we treat them with cock-up splints, anti-inflammatories, and patience, and tell them to hold on, and most do fine. I don't like operating on them myself anymore because some of them fail, as you noted. So I send them to my shoulder and elbow surgeons to do arthroscopic debridement when necessary. Morbidity is less, but very few patients need surgery, and I agree with the premise.
Thank you so much. Is there any questions on Thank you so much. It's good to listen to you again.